As cases rise, the debate over masks is picking up. Early this morning, the Virginia Beach School Board voted to require masks this fall.
On Monday, Chesapeake voted to make masks optional. During both meetings, parents and teachers on both sides of the issue stood before the boards to make their case. However, some cited misinformation. Sarah Hammond is digging into some of those statements to separate fact from fiction.
67 passionate speakers urged the Virginia Beach School Board to either require masks or make them optional. 54 people did the same in Chesapeake. However, some people's statements were just not true.
Even though there is not a single conclusive study proving masking stops or slows transmission.
That's not true. According to a study by the World Health Organization, face masks reduce the chances of infection by more than 80%. With face masks, the chance of infection was 3.1% compared with 17.4% without a mask. Over in Chesapeake, one mother claimed the CO2 levels from wearing a mask are dangerous.
Increased CO2 intake can cause many things, including but not limited to difficulty breathing, increased heart rate, and death.
According to the CDC, cloth and surgical masks fit loosely enough across the face to let CO2 out. The molecules are small enough to easily pass through the material, while COVID-19 respiratory droplets are much larger.
Something that kills hundreds of thousands of Americans every year, but we've never worn masks for it. It's the flu.
Many people have compared COVID-19 to the flu. 619,000 Americans have died so far from COVID-19. By comparison, the CDC estimates there are 12,000 to 61,000 flu-related deaths each year. Not to mention, COVID-19 symptoms can be far more serious and persist for months.
Now let's look at the risks. Developmental delays in learning, speech issues, the sudden inability to understand facial expressions because they're hidden.
The American Academy of Pediatrics says there is no evidence that use of face masks prevents or delays speech and language development. In fact, a 2012 study in Cognition, a scientific journal, says when children 3 to 8 viewed faces covered with masks, they didn't show any problems classifying expressions. For 13 News Now, I'm Sarah Hammond.
And so far, Chesapeake and York County are the only school divisions in our area to make masks optional. Suffolk and Norfolk have meetings in the next week to discuss the issue.